Hello everyone, I'm Anas Al Ubaidi, and the topic for this session or this lecture is Family Medicine Outpatient Certification Exam, which is part of Chapter 26, which is about review of family medicine and outpatient scribing. And it is within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The Family Medicine and Outpatient Certification Exam is an essential gateway for medical scribes seeking to establish their expertise in ambulatory care and family medicine. This certification validates the advanced skills, knowledge, and competencies required to excel in diverse patient centered outpatient environments, where a wide range of clinical conditions and varied workflows demand precision, adaptability, and professionalism. The exam serves as a vital benchmark, ensuring that scribes possess the proficiency to handle complex documentation processes and contribute meaningfully to interdisciplinary care teams across outpatient settings. Family medicine, often the first point of contact for most patients, plays a pivotal role in promoting preventive care, managing chronic conditions, and addressing acute complaints. Scribes in this domain must master the ability to integrate real-time patient encounters into thoroughly detailed, readable, and compliant documentation. The certification exam addresses these critical aspects, covering areas such as effective communication strategies, comprehensive documentation of patient histories, chronic disease management, and understanding multi-system interactions inherent to outpatient care. Earning this certification is more than a professional achievement. It sets scribes apart in a highly competitive field, enhancing their credibility and paving the way for career advancements. It signifies a deep commitment to excellence in patient care while showcasing a scribe's ability to meet and exceed rigorous documentation standards. Employers in outpatient and family medicine value certified scribes not only for their technical skills but also for their ability to adapt to the dynamic demands of family medicine settings, where patients may present with anything from preventive care needs to acute illnesses such as upper respiratory infections to chronic conditions like diabetes or hypertension. A critical focus of the family medicine and outpatient certification exam is on structured history taking, emphasizing the accurate collection of data on social, family, and past medical histories. Chronic disease management plays heavily into this narrative, requiring scribes to document longitudinal data that tracks disease progression and response to treatment. Proficiency in patient communication techniques, such as active listening, nonverbal engagement, and culturally sensitive approaches, is also tested, ensuring that scribes maintain rapport while addressing diverse patient populations. Additionally, legal compliance and billing processes form a vital pillar of this certification. Scribes must have an in-depth understanding of healthcare regulations such as HIPAA in USA, as well as intricacies, the intricacies of ICD-10 and CPT coding to produce documentation that supports accurate billing, operational efficiency, and medical legal safeguards. Understanding workflows such as those associated with annual health assessments, family planning visits, or chronic condition reviews ensures that scribes contribute to streamlined clinical operations without compromising the thoroughness or quality of care. Key points: mastering patient communication. Effective communication is a foundational skill assist in the family medicine and outpatient certification exam. Scribes must not only accurately capture provider patient conversations but also facilitate clear, concise, exchanges in high volume outpatient environments. Active listening, definition, engaging fully and attentively to capture key patient concerns. Example, when a patient describes burning chest pain, validate and ask clarifying questions such as, does the pain radiate to other areas? Relevance ensures correct documentation of symptoms, enabling precise diagnosis. Nonverbal communication, focus here observing silent cues like body language to assess the patient's condition. Example, noticing a patient wincing during a physical exam despite verbal assurances that they feel fine. Impact here helps identify unspoken complaints, enriching the provider patient interaction. And here is a diagram summarizing the patient engagement techniques. Cultural sensitivity, importance, understanding patient backgrounds to avoid miscommunication. Example, respecting cultural practices by using gender appropriate interpreters in sensitive discussions. Outcome, builds trust and ensures accurate history taking. And here is a summarized diagram enhancing healthcare through cultural sensitivity in healthcare on the left, on the right, importance, example, outcome. Documentation standards. The certification exam emphasizes creating clear, thorough, and legally compliant documentation. It's essential for continuity of care, operational efficiency, and adherence to medical legal regulations. Accurate data entry. Requirement here ensure all details match patient encounters to avoid misinterpretations. Example, recording family history of cardiovascular disease with father diagnosed at age 50 for risk assessment. Significance here aids clinical decision making while reducing errors. Standardized formats practice here adopt SOAP, subjective objective assessment and plan for uniform formatting. Example, organizing chronic condition reviews with clear distinctions between patient complaints and physical and physician evaluations. Benefit here enhances chart readability and ensures compliance with healthcare team needs. Legal compliance measures, a complete application here, adhere strictly to HIPAA guidelines to secure patient information. Example, avoid discussing cases in public areas or leaving documentation accessible to unauthorized individuals. The result here safeguards privacy and protects scribes and organizations from legal uh, repercussion or repercussions. Chronic disease management. Family medicine heavily focuses on longitudinal care for chronic conditions, requiring scribes to document outcomes over multiple visits. This skill is a core competency evaluated in the certification exam. Longitudinal data tracking, definition here, recording progressive changes in a patient's condition. Example, track HbA1c levels over time for diabetic patients. Importance here, demonstrates disease control and informs adjustments to care plans. Medication adherence, process here documenting patient compliance with prescribed therapies. Example, recording patient reports missing 2 doses of antihypertensive medication this week. Value helps identify gaps in treatment and educates providers on necessary interventions. Preventive care screening role support preventive measures via documentation during annual health exams. Example, mammogram pending for female patient age 50. Impact promotes holistic care and supports early disease detection. Legal and billing knowledge. Scribing in outpatient settings involves awareness of coding and compliance and billing procedures, ensures that documentation supports operational and legal frameworks. Coding practices requirement here apply proper ICD-10 and CPT codes for accuracy in billing and treatment records. Example, accurate coding for routine annual physical examination using CPT code 99396 ensures timely insurance reimbursement. Outcome prevents claim rejections and maintains smooth revenue cycles. Time and documentation standards mandate include accurate timestamps for each stage of the visit. Example, prescription issued at 10:15 a.m. Ensuring clarity about procedure timelines, a benefit provides a defensible timeline for audits and legal reviews. Medical legal safety focus here record consent forms and risk discussions precisely. Example, documenting procedure risks discussed, patient consented verbally and signed release form. Significance here protects providers and institutions from legal claims. Optimized study and exam preparation, candidates must adopt practical strategies for success in the family medicine and outpatient certification exam. This includes focused revision of core topics and familiarity with the exam format. Study resources materials here utilize official guides and validated Scribe study manuals. Example, practicing with family medicine focused SOAP note, SOAP note templates to improve skills. Advantage builds confidence and identifies weak areas. Practice tests purpose here simulate real exam conditions with timed assessments. Example, multiple choice tests covering chronic disease management or HIPAA compliance. Outcome here familiarity with exam style reduces anxiety and builds critical thinking. Peer learning groups approach here collaborate with other exam candidates for shared insights. Result enhances understanding through discussion of treatment scenarios. Summary tables. Next, we have tables to summarize what we have covered through this lecture. Table on essential skills in patient communication, skill description, example, importance, risk without skill. Skills, here we have active listening, nonverbal communication, clarification techniques, cultural sensitivity, empathy. Table on core documentation standards, standard description, example, key advantages, risk if ignored. Standards, we have accurate data entry, SOAP format, compliance with HIPAA, legibility, and clarity, timeliness. Table on chronic disease management documentation, component description, example, benefit, risk without documentation. Components, we have longitudinal data tracking, medication compliance, condition monitoring, preventive screenings, patient education. Table on legal compliance and billing aspect description, example, importance, consequence of non-compliance. Aspects, we have accurate ICD-10 coding, CPT, code application, timestamps, consent documentation, and then retention of records. Table on study and exam preparation strategies, strategy description, example, benefit limitations. Strategies, we have use of practice exams, peer study groups, time management practice, visual study aids, scribe manuals, and guides. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. What is an example of ensuring legal compliance in outpatient documentation? A. Using unapproved abbreviations to save time during charting. B. Discussing patient details openly in shared workspaces. C. Properly coding a diabetes diagnosis with the appropriate ICD-10 code. Or D. Avoiding the inclusion of timestamps for procedures. Definitely the answer would be C, as properly coding a diabetes diagnosis with the appropriate ICD-10 code, as using accurate ICD-10 codes ensures legal compliance and facilitates appropriate insurance reimbursements. Omitting such details can result in claim rejections and legal liabilities. Question 2. Which aspect of patient communication is critical for understanding unspoken needs or concerns? A. Asking only close-ended questions during the interview. B. Strictly recording vitals and leaving the provider to interpret patient emotions. C. Observing nonverbal cues such as facial expressions or body language. Or D. Avoiding any interaction with patients who seem overly emotional. So definitely the answer is C, as nonverbal communication often reveals additional information that patients may struggle to articulate, helping scribes document the full scope of symptoms or concerns. Question 3. Why is the SOAP format emphasized and outpatient documentation standards. A, it breaks down the medical record into a structured, logical, and universally recognized format. B, it allows scribes to modify notes without approval. C, it prioritizes treatment planning over patient history. Or D, it eliminates the need for provider annotations. Definitely the answer here would be A, as the SOAP format subjective objective assessment plan ensures thorough and standardized documentation, helping reduce errors and improve communication among healthcare teams. So the answer would be A here. In the question 4, what is the purpose of longitudinal data tracking in the management of chronic diseases? A, to replace the need for accurate symptom documentation. B, to monitor disease progress and evaluate treatment outcomes over time. C, to simplify documentation by excluding family medical history. Or D, to avoid recording routine follow-up visits. The answer would be B, as to monitor disease progress and evaluate treatment outcomes over time, as longitudinal tracking is essential for understanding how a chronic condition evolves and for making timely adjustments to treatment plans, enhancing patient outcomes. Here we have question 5. What is the best practice for maintaining HIPAA compliance when documenting outpatient care? A, discussing patient records only within designated secure areas. B, sharing patient files with unauthorized personnel for convenience. C, avoiding timestamps actions to reduce documentation length. Or D, simplifying diagnosis entries in public discussion notes. So the answer would be A, discussing patient records only within designated secure areas, as maintaining HIPAA compliance requires that patient data be protected and shared only as legally permitted to ensure privacy and safeguard patient trust. And here we come to the end of this lecture. Thank you very much and goodbye.